If you suffer from chronic sinus issues, you know how painful and how frustrating and how irritating it can be. But there's a new minimally invasive procedure out there that can help give you the relief that you've been searching for. I want to introduce you to Dr. James Gould from the St. Louis Sinus Center and his patient Don here this morning to tell us a little bit about this procedure you're actually going to do on the air for us, which is so cool. What is the procedure? Who's going to be able to benefit from it?
Yeah, so this procedure is balloon sinuplasty, and it's a little device that goes inside the sinuses to essentially unblock clogged or blocked sinuses really minimally invasively without removing any tissue or doing any real surgery. So patients who are candidates for it are patients who have chronic sinusitis or recurrent sinusitis, and they may have symptoms of nasal congestion, postnasal drip, facial pain, pressure, sinus headaches, and that type of thing.
We live in an area that's very well known for being difficult for allergy sufferers. There's probably a lot of people watching right now who think that's the root of their problems, but in reality it might be something more serious, more chronic than that.
They may have chronic sinusitis or allergies, and sometimes patients have both. So we really like to, at the St. Louis Sinus Center, basically detect whether there's allergies or sinusitis. Most patients need a sinus CT scan to demonstrate whether they have chronic sinusitis or not, to see if they're a candidate for this procedure.
Now this is the tool that's actually going to go, I hate to be so blunt, but up Don's nose.
That's
basically.
Right, exactly. You got it. So this is the Express multi-sinus dilation tool, and it's got a little balloon on the tip there, if you can see that, and I'm inflating it now.
Filling with fluid.
Yep, and that balloon is what opens the blocked sinus, and it really increases the diameter about 6-fold. And it's really a permanent, durable result that lasts long term, and it really only needs to be performed once.
Don, you're a good sport. You ready for this?
Sure.
Okay, no yeah, now you've been working with him a little bit too. We'll talk more about that coming up. Dr. Gould is going to perform the actual procedure right here on our show. He's a brave man, so is Don. So stick around. We will check back with him in just less than 3 minutes, really, Virginia. This ought to be interesting. Wow, this is going to be fascinating here. Welcome back to Great Day St. Louis. If you're just joining us, we are about to have a great day first. This is Dr. James Gould from the St. Louis Sinus Center. He's about to perform a medical procedure live on our show. It's called Balloon Sinuplasty, and it can bring huge relief to those who suffer from chronic sinus issues. All right, Dr. Gould, so you prepped Don, your patient here this morning, a little bit during the commercial break. Tell us exactly what you're doing and what we're able to see on this monitor here.
So Don has chronic sinusitis, and he's had problems for years, and this is the tip of the Express multi-sinus dilation tool, or the balloon sinuplasty device. I'm going to go ahead and insert it into the sinus opening now. As you see, there's a little light on the tip of it, and we're now rotating it into the sinus opening. And now we're into the sinus opening fully, and now I'm going to advance or deploy the little balloon, which you see coming into the field there, into the sinus opening. And it's this little balloon that provides the instant and lasting relief that we get with this amazing new procedure. So here we go. We're going to go ahead and inflate the balloon, and you'll see the sinus open up. Inflate, please.
Wow.
Okay, and actually deflate, and inflate again. And deflate.
Now, Don, as he's doing that, what do you feel?
There we go. Now you can really see that.
Do you feel anything at all, Don, or are you?
No.
No.
I don't.
So no pain or discomfort?
None at all.
Wonderful. Okay, so after 10 seconds we deflate the balloon. We get a lot of questions about, do you leave the balloon in, or how long does it have to stay in?
Is there some sort of stent that stays in there?
Not at all. We actually are remodeling the sinus opening completely. And I'm going to go ahead now and take the balloon out, and that's all there is to it. It's really literally that simple.
And that sinus cavity won't close back up?
No, because we've really remodeled the actual opening with the balloon. It actually is enlarging or expanding the bony opening. It doesn't collapse back down like you would see in a coronary artery, which requires a stent.
That took, what, a minute and a half, 2 minutes, maybe?
Yeah, at most, exactly.
And so now you're going in the other nostril. About how far from the opening of the nose are you actually going up there?
You know, it's about 5 centimeters. So about 2 inches,
couple of inches,
a little bit further than that. So we're going to go into this side. Same thing, we're going in behind the sinus opening here, called the uncinate process, and going into the sinus opening. You can see the little light going behind the uncinate process, and then we slip the balloon in, and we're fully inserted into the sinus opening, and we'll advance the balloon in again on this side, And we're going to go ahead and dilate, inflate. You can really see that open up, and you can
Holy
actually
cow.
hear a little bit of crackling and popping, and that's where the bony area opens up. It's kind of like eggshell thin bone, but you can see it's really completely painless. And deflate. And this is revolutionizing how we look at and treat chronic sinusitis in St. Louis and really all across the country.
This is outpatient, I assume? I mean, they're not spending the night somewhere?
Oh, totally outpatient. It's done in our office, you know, under local anesthesia, back to normal activity the same day or the next day, and really most patients report some degree of instant relief.
Wow.
So that's pretty much it. How do you feel now, Don?
Fine. Hasn't been any pain. Feels pretty open.
Awesome. And how's your breathing right now?
Normal.
Good. Excellent. So that's a big change.
These are good signs.
Yeah.
Wow. That's and I mean, literally, that took 3 minutes. What you didn't see is before the show, there's just a little bit of prep, but
Very minor.
not a great deal.
Yeah. So very simple.
Dr. Gould, thank you very much.
Thank you.
And I can't tell you the undertaking it was to get all of this equipment downtown. Doctor's working with a lot of good people here that helped them out, so we appreciate that. For more information on balloon sinuplasty, here's what you do. Call that number on your screen right there. It is 314-4-RELIEF. That's 314-4-RELIEF. Dr. Gould has 2 locations. There's Synergy ENT Specialists, which is located on Highway 61 in Festus, and St. Louis Sinus Center on Olive Boulevard in St. Louis. Virginia, how was that?
I want one.
I know. I told him he's going to have a line of people suffering with this from the newsroom out here in about 5 minutes.
I can't remember a day I didn't have sinus problems.
Yeah, look into it. Check it
Wow.
out.